Hello everyone, this is the 10th episode in the Age of Pandemic series. If you're new to this channel, welcome. I talk about various human issues against the background of the COVID-19 pandemic. They are all issues that the pandemic keeps throwing up. Some of them are existing dilemmas that are being exacerbated by the pandemic. Today, I will revisit the topic in the first episode, depression. In that episode, I had said the perfect conditions for acquiring depression have been created by the coronavirus pandemic. That was in April. I want to talk about the conditions since then and how they have given rise to new apprehensions in the minds of people. Add to that, the mental health infrastructure in many countries, certainly my own, continues to be terribly inadequate to address this problem. I want to begin the 10th episode by thanking you for helping me reach this milestone. You have watched the series, liked and subscribed. You have shared your thoughts with me. But that is not all. Your support and encouragement has actually saved me from a personal quandary, and for that I will be grateful to each of you for the rest of my life. You see, my law practice has been affected badly by the pandemic. The courts have been closed since the middle of March. Some of my clients are facing problems in their businesses and affairs. I get by financially, but I must confess that this pandemic has made me worry about my future. And on a day-to-day level, my not working has left a huge void. So I started reading about the psychological impact of the prolonged lockdown. Then, given that the entire world was feeling the impact of the pandemic in some way or the other, I started reading about world developments and tried to add new layers of knowledge to some of the views I've held for a long time. I wanted to share these, the perspective of a millennial from India, a developing country. That's why I launched the Age of Pandemic series to present my perspective on global issues. The intention is to plan better and I think find solutions. Forming a relationship with you through every video has helped me understand myself better. All the episodes, whether on feminism, human rights, free press or economic inequality, have liberated me from my worries. I could not have reached out to you without the support of my husband, who actually edits the videos, so half the work is done by him. And of course our families and our doggies. We exchanged knowledge and debated, and of course there was fun and games with the doggies. So thank you, and thank you YouTube. I hope that all of you can keep yourselves safe from the contagion and continue to inspire me. After the first episode on depression, the world's leading mainstream media platforms have covered this subject extensively and intensively. But reading about the Indian actor Sushant Singh Rajput's death by suicide last week has been particularly jarring. He was a talented actor with great performances, a sensitive soul, a promising life. He parted with his millions for the poor and helpless, and he was just 3 years older to me. The deceased actor suffered from depression. Because it is not politically correct to acknowledge it, and because some societies will not acknowledge that this is indeed a human condition, and because despite our progress in the humanities, the sciences and commerce, we are still attached to the cult of success worship, it may be a long time before this actor's soul finds peace. And did you know, 3 of his fans from 3 different parts of India have died by suicide since? According to news reports, they suffered from depression and one of them, a 16-year-old boy, could not bear being bullied. In his suicide note, he actually apologized to his father for being effeminate. People are dying, even young people, from this unseen pandemic of depression. Imagine if you had to place your hand in the gap of a door and slam the door shut again and again. Imagine the pain you'd feel. That's the kind of pain some people feel day in and day out. They feel the world closing on them, and some of them are unable to bear that, and they think there's no way out and that ending their life is the only option. It is a pain nobody can physically describe. because the pain caused by depression is even more excruciating than physical pain. Depression is the new age's unstated and most feared terror, not the economic variety which can be contained with adequate capital input. Some people who have depression describe it as a cancer of the mind. Depression is a disease that cripples not only the mind but also all the auto-responses and even muscle memories of humans. It kills. As the rampage of the coronavirus continues, 8,750,000 people worldwide have been affected and 463,000 have been killed. However, we are seeing government, industry, and civil society at a point of strange confluence. They seem to have struck some kind of consensus. Earlier, governments tried to prevent the contagion through overt caution, through total lockdowns, stopping trade and human movement, thinking some sort of flattening of the curve would be possible before a quick remedy is found. But recently, even as COVID-19 cases spiked and new areas emerged as so-called epicenters, this team of government, people and industry have returned to the world before the pandemic began. They say that whatever happens, even if healthcare systems collapse, even if the death toll rises, the more visible dragon of economic recession must be slayed. But in most countries, little thought has been spared for the human being, the very reason for an economy to exist. Now let's talk about India and China, whose relationship, or the lack of one, has been dominating the news recently. India gets the smallest outlay of healthcare in the world compared to its GDP, despite a population of 1.3 billion people. The healthcare system of India has all but collapsed. India now occupies the 4th position in the list of countries worst hit with the COVID-19 pandemic. Yet, lockdowns are not being reinforced and we hear that the public health restrictions are going to be minimized. Clearly, a high-risk route to economic revival is being adopted. This is probably being done under the illusion that once people get back to work, the social impact of the pandemic can be internalized better. After all, everyone's eager to get back to normal. On the other hand, in China, with much fanfare, the government announced the reopening of production and service centers. But the coronavirus struck even more vehemently.
Tonight, China is racing to contain a new outbreak of COVID-19. After reporting no new infections in Beijing for more than 50 days, the virus has returned. Here's CBS's Ramy Inocencio.
Tonight, parts of Beijing under lockdown again. Officials there calling it wartime mode. Schools closed, transport in and out of the city shut down. There are now more than 100 coronavirus cases linked to Beijing's Xinfadi wholesale market. Health officials scrambling to quickly contact trace, testing an estimated 200,000 people.
In the first episode, I had talked about some apprehensions that may overwhelm people, young people in particular, as their livelihoods collapse and dreams evaporate. Since then, there have been reports of various other mental health disorders, such as paranoia, anxiety disorders, post-traumatic stress disorder. Now, 10 weeks later, I see from my personal interactions some new apprehensions which are gripping people. Let me tell you, many people who have succeeded in avoiding the infection seem to be manifesting the mentality of soldiers in an intense, prolonged war. They seem to be thinking, I have survived not because I have been careful, but only because I have been lucky. There are stories about people catching the infection through bizarre situations, like the pizza delivery boy in Delhi, Prime Minister Boris Johnson, cricket hero Shahid Afridi, the Health Minister of Delhi, and high-profile politicians, Tom Hanks and his wife. The overriding thought now is that these people took all the precautions but still got it. So, what chances do I have, little old me? This is fatalism seeping into the depression narrative. It might have deep implications on the social impact of COVID-19. What is feared is the gradual abandonment of precautionary steps like wearing masks and social distancing. This is the social mood now prevailing. You may have noticed how many people in that video did not wear a mask and how unaware all of them seem to be about the concept of social distancing. Do these people think they are immune? Or have they surrendered to fate? Either way, this will only lead to greater and greater infection. This dangerous consensus that I had spoken of earlier is responsible for this mindset. young people worldwide are voicing awareness of their mortality at far higher degrees than previous generations did at their age. Youth is no longer a time of gay abandon, but boils down to living day by day. The constant brush with death is making people evaluate in negative light the wisdom they have received on most things, from values to God to public morality. Suicide is already one of the leading causes of death in many countries. The World Health Organization's figures show that close to 800,000 people die by suicide every year, and for every suicide, there are many more people who attempt suicide. In fact, in 2016, suicide was identified as the second leading cause of death among people between the ages of 15 and 29 years globally. That was in the Anthropocene era, when human beings were boss. Now, in the age of pandemic, we are the underdog. It struck me recently that we are only about 7 billion or so. That is, the global human population is 7.8 billion. But SARS-CoV-2? No census is possible, but that virus could already be in the trillions of trillions of trillions. We are at the mercy of this virus. Well, I have internalized the fact that a credible vaccine may take a long time to arrive at a dispensary near me. I have also accepted the fact that my country's public health system will surely fail me. But there is another disconcerting reality that has to be confronted, which is that governments around the world spend less than 5% of their healthcare budget on mental health. Developing countries spend around 2%, and India spends less than 1% of its federal health budget, which is less than 2% of the GDP. In no country in the world, however developed it may be, can the public healthcare system be considered enough to cope with the mental health crisis that we are being warned about. Therefore, it is time that civil society and public intellectuals began speaking up and addressing this problem. When coronavirus struck, we realized that we didn't have enough masks, gloves, ventilators, and even a proper epidemiological regime for treating killer viruses, even 18 years after SARS. Someday, all the predictions of a global mental health care crisis might come true, and we will then realize that we don't even have enough specialist doctors to treat it. I leave you with this thought. Please be safe. I hope you will be honest with yourself about your mental health. Please talk to someone and do consider getting professional help. Thank you for watching. Take care. See you next week.